Welcome everyone to the inaugural third Thursday at Northwestern Health Sciences University, the Human Performance Center at Northwestern, in collaboration with the Minnesota Chiropractic Association. We're proud to offer this opportunity every third Thursday, every month, an opportunity to gather and listen to some experts talk about sports and performance cases. Students that are here, welcome. It's great that you're willing to spend another extra hour of your day here on campus. But it should be a great learning opportunity. Welcome to our guests that are postgraduates, possibly from Northwestern and alumni, and certainly to the Minnesota Chiropractic Association. We welcome Dr. Maureen, past president of the MCA and collaborator on this initiative. I've got a few, couple things here to mention before moving on. We want to thank our marketing department here, Rick Jordan, who very quickly put together some marketing opportunities, emails, Facebook announcements, etc., announcing this impromptu. And we've been thinking about this for many months, actually, but we decided very last minute to start launching it the very first month of 2016. So we're excited we did this. We're glad that you're here. Also want to thank James for getting up early as well this morning to videotape this. This will be a recorded series. We're going to be creating a third Thursday library. As this library builds, we'll probably launch it with our continuing education office as well. So you can always reflect back to some of these cases as they're being recorded. I want to thank Tree and Fairview. I don't think we have any Tree or Fairview people here, but we've also reached out to them, and they're also marketing this opportunity to their market. So we hope to have multiple disciplines here. I know we have one massage therapist, but I hope we have other disciplines here, as well as physical therapists, orthopedic surgeons in the very near future from our friends from Tree and Fairview. In regards to CCSP CEUs, it probably doesn't help our students at this point in time, but if you are talking to other docs that are CCSPs or diplomates in sports, I'm pretty sure that this opportunity will count towards their continuing education that they're required to do, that I'm required to do every year. So that's why we have the forms in the back. So if you haven't signed in, where Alex is in the back there, please sign in. There's a half sheet of paper that you're going to want to keep, maybe even as a student, just to have record that you attended this seminar. And then we have a full page survey, so please complete that. And then lastly, I just want to share some news. Ben Jelinek, one of our students, took gold in his poster contest, a research study that Dr. Moose was putting together. And he did so well at the national conference in Denver that a past president of the ACA Sports Council wanted to raise the bar a little bit. And this is the first time ever, as I understand, that a student from a chiropractic student at all was asked to present at a more broader joint commission presentation. So Dr. Ted Forkham from the West Coast asked Ben and Dr. Moose if we could present his poster at the Joint Commission of Sports Medicine and Science. That's a big deal. I mean, that's massive. And lo and behold, soon-to-be Dr. Ben Jelinek and Dr. Moose took second. They were runners-up on this Joint Commission poster contest, and it was for graduate students. And it, again, probably set a precedence for chiropractic students. So that's really neat. I just wanted to announce that. So again, for those of you that are just coming in, please sign in the back. There's a half sheet of paper for the docs that are coming in just for evidence that you were here. And then there's a survey where we'd like to get some feedback on this. So this is a great turnout. I'm really happy with the turnout. And without further ado, I'd like to introduce our presenters today and very briefly allow them to introduce themselves a little bit more in detail. But I'd like to present Dr. Liz Moose, who's our second year Human Performance Fellow. It's nice to be able to call her a second year fellow now. It's fantastic. And Katie Moxness, who is a sports acupuncturist who's helped us out a lot in regards to the Human Performance Center. So I think we've got a really good case presentation this morning. Over to you, ladies.
So just to kind of give you a little bit of information about what the Human Performance Center is, it started in June 2014. We have Dr. Stark, who is our director. There's myself, and then Dr. Tronson, who is not here. But we are the two fellows, and then we have a number of contributors. Dr. Williams, Dr. Jonathan Williams, Kate. Mary Smith is the sports massage therapist that works with us, a Northwestern grad, and continuing her education here through our undergrad program. And then also Dr. Scott Munsterman was pretty key in starting the center, as well as our sports interns. And some of our objectives is to be a resource for the university and the community in sports medicine and rehabilitation. So through that, we're doing things like baseline concussion testing and pre-sport physicals, as well as providing sideline care and staffing an athletic training room at a local high school. And so through this, it's a multidisciplinary, so any of our students here can participate to their level of training at that time. And then our more clinic-based opportunities, so the training room and this injury prevention clinic, it's actually an applied position. So our sports interns, they have to prove that they've taken those extra steps to be involved not only in the university but also with sports medicine. Next, I kind of want to answer the question about what is integration. It seems to be kind of this buzzword that, to me, before I dug into the research, just didn't really hold a lot of meaning. Turns out there's definitions. And so Heather Boone is really kind of the front runner of what on this integrative research. And she describes it more as an integrated, or a continuum of integrative care. So it's multi-level. They are listed out there on your right, my left. And so I'm just going to define these here quickly for you. So parallel care that's characterized by independent healthcare practitioners, each working in a common, or they're working in a common setting, but kind of doing their own thing. Each working to their own level of, or to their scope of practice, and that's about it. The next is consultative, and that is expert advice given from one professional to another. It could be through direct communication or something as a referral letter. Next is collaborative. Collaborative are practitioners who normally practice independently of each other, but they happen to, just communicate on that kind of an informal basis on a shared patient. It's, as I mentioned, it's usually case by case and informal. The next is coordinated care, and that is starting to get a little more formalized. So it's a structure that requires communication and sharing of patient records between the professionals, and then they meet intentionally to decide what they're going to provide for that patient. They usually have a case coordinator who is not necessarily a physician underneath this coordinated care. Next is multidisciplinary, and that's characterized by teams managed by a leader. Again, it's usually one or two individuals that direct the service in the range of ancillary members, and they may or may not meet face-to-face. From there, interdisciplinary, it kind of emerges from that multidisciplinary model, and then the practitioners that make up the team meet in a group. And so they're meeting face-to-face to kind of discuss this case. And then finally, integrative care. And that consists of an interdisciplinary, non-hierarchical blending of both conventional medicine and complementary and alternative healthcare that provides a seamless continuum of decision-making in a patient-centered and supportive environment. And a specific set of core values that include the goals of treating the whole person. And so one comment that was in the article that I really liked is an interdisciplinary team approach guided by the consensus building of mutual respect, shared vision of healthcare that permits each practitioner and the patient to contribute to their particular knowledge and skill within the context of shared synergistic change in charge of the planned care. And so it's really about the patient. And that's an important thing about integrative care is it's not what you're doing for the patient, it's what can we do for the patient.
All right, so we're going to talk a little bit now about how we are functioning in the Human Performance Center and what that integrative care actually looks like. we're gonna talk a little bit today about the timeline and how things have come about in the Human Performance Center and kind of where we're going. We're gonna talk a little bit about the challenges that we see and the benefits that we see for the athletes in the way that we are running the Human Performance Center currently. Dr. Moose has put together a lovely online sign up for athletes. So as teams come on, right now we're working with the Minnesota Vixen, and you can see their logo down here. So they have an online sign up, so they can, when they start to work with us down in the Human Performance Center, they can go online and they actually choose at the beginning what would they like, what type of care would they like to get. That's an interesting way to kind of give the patient a little bit of direction in their healthcare, right? They say, this is what I feel like I need. The one thing that I found has been beneficial so far at the very beginning of the season or beginning of the off season where they're doing a lot of strength training and things like that, we have the different practitioners in the office come and give a little talk about what we do, right? Because there's you can, for me particularly, I can say, how many people have had acupuncture? Maybe one person or two people raise their hand. I don't really know about that. And some people the same, they've never had chiropractic care or a massage even. So it's interesting with the online sign up to see who decides what kind of care that they want to get at the beginning. Another change that we'll talk a little bit more about later is there's enough women so far that have been coming in and getting all three types of care and the benefits that they're getting. They end up going to talk to their teammates. Their teammates come back and say, yeah, actually I'm gonna sign up for all modalities right off the bat because we see all my other teammates are getting such a huge benefit out of seeing all three modalities. So we have this online setup and you can see all the different types of care that we have currently down in the Human Performance Center. Each patient is evaluated through the types of care that we provide by each of the specialties, and then we communicate about that. So we do have cross referrals. We do talk to the women out in the lobby and say, hey, these are the types of things that are happening down here, and the cross referrals a lot of the time will happen on the fly. They decide to sign up for chiropractic and they go, Dr. Moose and the interns evaluate what's going on with the athlete. For instance, they've had migraines for 10 years. Okay, how many chiropractic adjustments have you had? Well, I've been getting one a week for the last, 2 years, and it's great to be part of the Human Performance Center now. Wonderful. There's something else that we can maybe add. Hey, Kate, do you think you and your interns can get this person in the next week, or even today? So it's actually a lot of cases happen on the fly currently at the Human Performance Center, and then that ends up turning into the online sign up. So it's an interesting way for me actually to watch athletes, especially when they're coming into a brand new clinic, deciding what care they think they need and seeing how that transforms over time. One other thing that we've integrated into the integrated clinic is having our discuss cases before the start of the clinic. So we'll sit down as our supervisors and specialty practitioners and have our interns there as well. And we'll pick out cases that are happening throughout the day. For instance, these 4 people are coming in to see all 3 disciplines. How are we gonna approach this patient today? There are some modalities that we have in our care that are somewhat similar. And do I need to be doing massage if they're also going to be doing massage? Do I need to be doing wash off if you're gonna be doing grasp technique? So there's those types of conversations that we can have. What areas of the body are you gonna work on? Because it's an injury prevention clinic. We work a lot with wellness. So if I'm gonna be working this area of the body, maybe the chiropractors are gonna be working on the low back. Maybe we're both gonna be working on both. But all of that's really important to be discussed at the beginning so that we can give the patient the best possible care when they're coming in for a fairly long period of time to see all 3 modalities.
And just to give a brief overview before we dive into a few cases. So what patient care looks like for our Minnesota Vixen currently is they can be seen in the injury prevention clinic, as Kate just mentioned. We really try hard and we have a really good relationship with the coaching staff. So that is part of that integration as well as they've kind of given us the leeway that we can jump in practice and kind of change that on the spot. And then as well as sideline triage. So now I'll take some cases to kind of show you how we've integrated. Our first patient is actually not a vixen. So when we first brought on the traditional Chinese medicine, it was during the off season, and we had two fantastic interns that we wanted to make sure that they were also getting a quality experience. So we pulled from a few cases out throughout the university. So this person was an active male with several years of, or several months, sorry, not years, of heel pain that wasn't really responding to care. He would get a little bit better, and then he'd go out for a run and it would come right back. And so he was getting pretty frustrated. He had been seen in the Derecho Learning Center, so the DLC, and they took x-rays which ruled out any sort of fracture or anything like that. He received adjustments and then cold laser, but as I mentioned, the pain kept coming back, so he was starting to get a little concerned. So we invited him to come down, and so we did our chiropractic evaluation. There wasn't any significant injury we could find to that region. So we did some ankle adjusting. We did a lot of Graston technique. We told him to continue care down in the Derecho Learning Center. They had some modalities that we didn't, such as the cold laser. And then we also, he was very concerned about it being inflamed. So we kind of paired up, and Kate will touch on this as well, but we talked about nutrition counseling. And at this point, there wasn't massage yet down there, so that's why he did not take advantage of the massage.
Okay. So diagnostically, traditional Chinese medicine has some different wording that we would use, so I'm gonna try to kind of bridge between the East and the West here. So if there's something that you're confused about, you can kind of just put your hand up and I'll try to explain a little better. So diagnostically, when he came in, he's sweating, his tongue is bright red, he's having all of these tendon sorts of issues, right? And so when I'm talking to my interns, they're like, wow, this case seems pretty clear. Like, the inflammation just keeps coming back. And part of what interests me so much in working with athletes is there's a lot of, and this person does a lot of running. So anybody that's an athlete, we can all be athletes. What interests me a lot about working with athletes is it's not, your performance doesn't just depend on, can I move my legs? Can I throw the ball? Can I, throw the Frisbee? Whatever it might be. Can I run for miles? If that performance also depends a lot on how are you digesting your foods? Are you able to treat, or is your body able to recover after a workout? Are you sleeping? Is your body recovering after a workout? If for the female athletes, during your menses, are you having such bad cramps that your body's concentrating on not getting, your legs going for the sprint that you need to perform, or whatever it might be. So a lot of times when I talk to athletes, I talk about the wellness model and integrative care because I feel like it's such an important thing for athletes to understand that it's not just, I gotta get my shoulder joint back in line, but if that underlying cause or whatever's going on in your body that's not allowing that to heal, if you don't also work on that part of it, you're just gonna keep having recurring injuries. So in this case specifically, you'll see another one. We see a lot of heat happening for athletes, and we can kind of go into that a little bit later, but working with this athlete, it was very clear, which was exciting for the interns as well, to see a case that it was like, okay, this is a great case for integrative care. He's getting results, the inflammation keeps coming back. How is that happening? Acupuncture in its very simplest form, right? We are increasing blood flow, you're doing a tiny microtrauma, so we're increasing blood flow and decreasing inflammation. So we had this person, then as we're going through our intake, we're talking about digestion. I mean, spicy food every day, having bad acid reflux, eating at 10 p.m., drinking a gallon of milk right before they go to bed. I mean, there was a lot of changes that could happen in a simple way that this person had no idea how it would be connected to any other part of his body. And as we all know, in the care that we do, our bodies work as a whole. And so giving patients, some of those little tidbits, working on maybe not eating nightshades, the nightshade family, it's going to be pro-inflammation for people. So, some of that little care for him actually made a huge difference on top of working with all the modalities. So my interns here are also trained in Tway Na massage. The school that I went to, the medical school I went to, I was also trained in shiatsu massage. So we did actually integrate some massage into this, but it wasn't the hour sessions or 20-minute to 30-minute sessions that they can currently get in the Human Performance Center. So that was integrated as well.
And just another note about this particular patient is, and what we were able to provide for our interns. Kate mentioned the heat and how that affected the body. When we were doing this nutrition counseling, we set that specific intern that was working with this patient, we sat down and we looked at what I would do from kind of the chiropractic nutrition side, and she went through and she said, well, actually that is pro heat, and so maybe don't give that one. So it was really, we went line item by line item through the nutrition interventions we wanted to provide for him to make sure that it was benefiting both of our areas of expertise. Our next patient, I have X number of year because I forgot to ask her, but she's been a veteran for a while. And when we first opened up the injury prevention clinic, she was one of the ones that took regular advantage of this. In December, she presented to our clinic, barely able to walk in, couldn't really go from sit to stand, was moving a keg, and has had this new back pain she's never experienced before. So through the exam, we ruled in that it was an injury, and so unfortunately she was not able to be seen. She had radiating pain down the leg. Her motor sensory reflexes were normal, but her straight leg raise, her Valsalva, they were all positive. So she was referred to the Northwestern Health Clinic, Bloomington. She did not take advantage of that. And then we also gave her just a couple of exercises. And the reason why we gave her exercises was because she was worried about her spot. And this was during her spot on the team, and this was during the strength camps. So she wanted to be present at the strength camps and show that she was doing something to kind of help this injury move along. So she was given McKenzie extension exercises because that helped centralize the pain. And then some core work, so very minimally invasive core strengthening.
Now I'm just going to add my short line in there. So in the injury prevention clinic, if there are positive tests saying that there is an injury, we do need to refer out. So that's part of what Dr. Moose was talking about. In this particular case, because we were going to have to refer out for the pain that she was having, one of the things that she brought up said, I'm just having trouble quitting smoking, and I think I'm ready to do it. Do I have to go upstairs or to a different clinic to be seen? I said, well, for smoking cessation, there are some things that we can do. Let me put some ear seeds. Have any of you had ear seeds ever put in your ear? Okay, so thank you for the couple people that have. The other people that haven't, I'll give you a little bit of an idea about what we do. There are different types of seeds that you can use. Traditionally, the seeds that we use in the ear are called Wangbu Liu Xiang. It's vicarious seed, and we actually use it in herbal medicine as activating blood and reducing pain. Now, when we put the seed in the ear, it doesn't actually act in that exact way. It acts as a very small point that can be stimulated on the ear for multiple days. So it's basically taped to your ear at a certain point that can activate different areas of the body. So there's not a protocol that's used for smoking cessation and people that are coming off of drug withdrawal and things like that. The NADA protocol is also used for things like in Hurricane Katrina when there's a lot of emotions that are running high. It can also help calm people in emergency situations. So was able to give her a little bit of treatment that day for something unrelated exactly to the back pain, but as we all know, smoking and putting tons of toxins in the body is not going to help anybody recover. So was able to help give her a little bit of care that day.
And just an update on this player, she has recovered. She is now on a limited practice, so she's back at the game. Our next case study, this is a second-year player in very good physical condition. She started using our clinic in the off-season when we added the TCM practitioners, and massage was kind of coming for the trifecta of care. So on the chiropractic side, you know, every once in a while she kind of has this subclinical knee pain that'll come up, so we might do some Graston or some soft tissue work towards it, but mostly just wellness adjustments. And then the massage therapist describes her as having perfect tissue.
So one of the things that came up during our intake with the interns, this particular patient, when we got to the sleep portion, was like, yeah, I think I sleep okay. Okay, do you wake up at night at all? Well, yeah, quite a few times actually. I have super severe nightmares, like trembling nightmares, like vivid nightmares, running nightmares. And okay, that's kind of an important thing for us to know. Let's talk a little bit about that. You know, we talked, and then you go through the rest of the intake. And one of the other things that stuck out to us in our modalities were her digestion. She was having eating lots of spicy food, eating lots of things that seemed to not digest. Her bowel movements were very, very loose, either that or very, very constipated. So it was one of those things that, again, talking to athletes, actually this matters a lot. So if you're not sleeping through the night and you're running all night in your dreams, how do you feel like that's going to affect you on the field? If you're not digesting your food properly or eating the right things that are helping nourish your body, how is that going to help you rebuild your muscles to be have a better performance? So we worked actually quite a long time on, we still see this person weekly, and she wasn't even quite sure about acupuncture at first, and she absolutely loves it now, and she has no nightmares. She was having them every single night, so she has 0 nightmares. A lot of that was nutrition counseling. I think there was a lot of digestive things that were contributing to how she was sleeping at night, but lots of relief in that area. So.
And our last case study is another longtime veteran. This particular player had surgery on her Achilles tendon in the 2015 season. So now she had been cleared by her physicians to play, and so she was coming in for regular wellness adjustments, as well as wanted some Graston technique on her scars and her calf, just to kind of remain loose so that she could potentially play this season. She's another one that was receiving regular massages as well. Nothing super notable, just kind of making sure that that foot is in a good position as she goes into this season.
Okay, so when we did a lot of before the athletes come in, we talk about the cases. This was a very clear person that having an integrative approach would be great for. Especially on days that Graston was happening. How are we going to help complement that? Or who's going to go first in care? How do we want this patient to walk out? And what was the last modality that we want them to have that day? What are they doing after they come into the clinic? So this is a great example of all of us using all of our modalities to help this athlete get back on the field. As you can see, some of the acupuncture, scar therapy that we were working on really complements chiropractic Graston technique. And so it was, even the patient would talk about every time, wow, this really feels like it's working together. Let's see what else we worked. This was another example of somebody that had fairly poor digestion and actually fairly severe acid reflux that wasn't working super well with the medication that they were on. So referred and told them that they should probably take a note to their doctor and ask them about what type of medication that they could be on so that they could get that reduced. Also did a lot of dietary therapy and counseling with this person. Also did topical herbs. So there are a lot of ways that in Chinese medicine, my approach to herbalism, everybody says, oh, you ran one of the biggest medicinaries in the Pacific Northwest, you shipped herbs all over the world, you did all this research, and I'm actually fairly minimalist. I think part of that is there's so many digestive disorders that are kind of springing up in the United States, or maybe we're just becoming more aware of it. So I don't like to always, especially with athletes, say, yep, you gotta take all these internal herbs. So starting with a topical herb is a good introduction for people, especially when they're having digestive upset, to actually help with, again, reducing inflammation and creating that blood flow. Complements the Graston technique, and also the scar therapy we're using acupuncture for as well.
And kind of as Kate mentioned, and because this particular case we talked about quite a bit, not every time she got everything. So there were some days where they got rather aggressive with needles, and so it wasn't appropriate for us to do Graston technique right afterwards. There were times when they were running a little bit behind, or they wanted to focus more on that digestion and the nutrition. So we got a little more aggressive with our Graston technique. So it was really important for us to, this is an important case for us to kind of collaborate on and talk about.
Yep, so just to kind of overview the 4 cases that we went through, so you can kind of see how the integrative model, how we're approaching that in the Human Performance Center. As Dr. Moose talked about earlier, there's lots of different ways you can use the word integration, and we're really on the floor working together for the athletes. So sometimes somebody comes in and they are getting one type of care, and we do a cross referral. Sometimes we're talking about the cases and saying, what do we feel like is going to be best for the athlete with all of our care today. And sometimes they see one person and that's totally fine. They see one modality and they're fine. They're having some back pain, they get an adjustment. I don't need to be putting tons of needles. They've had great digestion and, perfect soft tissue, as a massage therapist says, or whatever. So there are times that people aren't needing all 3 modalities, but the type of integrative care that we're using in the Human Performance Center has benefited a lot of athletes because we are so integrated in how we're approaching best care for the athletes. And they also are using, like I said at the beginning with the online scheduling, they are also part of their healthcare. They're going, what do I feel like I need, and why is that? So they're very active in how they're getting care in the Human Performance Center as well, which I think is a patient-centered model and has been working really great for our athletes so far.
And with that, sometimes things happen in the room where you might change our whole treatment plan. Our most recent example is someone had a current headache and you guys were needling her in her suboccipitals, and that was too much for her, so they kind of pulled back and they spent some time doing massage. Well, when she came to chiropractic, it was perfect because then that was all taken care of. So we, adjusted her and then gave her a few exercises so that she could go and do these exercises at home to kind of help prevent them from coming back. So it really, yes, we have our formal meetings, but because we're all in the same hallway, we're constantly bumping into each other. We really encourage our interns and we try to lead by example by just kind of giving each person an update on what we're finding so that they know what to expect with the athlete. As I mentioned earlier, the integration with the coaching staff has also been a really important factor in with this team. So we have an off-season strength and conditioning camp, and this year it was run by Dr. Tronson and the Northwestern Health Sciences Strength and Conditioning Club. And then during the season, we actually have the last 30 minutes of their practice to do conditioning. We do some core work and then also mobility training. And during that time, first we're trying to do build up their cardiorespiratory system. But with the core, we're trying to add more sport-specific, exercises. So in this bottom picture, Dr. Stark is actually teaching them cervical flexion exercises to help increase their neck strength, which hopefully will then help prevent, maybe concussion or whiplash injuries. Some of the other things we like to incorporate there are, we teach them co-contraction of the knee so that they, they're female athletes. A lot of them are deconditioned. So they kind of lock up that knee, and last year we had 4 or 5 ACL tears. And so hopefully, if we teach them how to co-contract, we can prevent that kind of stuff coming up in the future. As I mentioned, we also have been given the leeway to pop in practice. I don't run in the middle of practice and say, excuse me, your form is wrong. I'll pull an athlete to the side, or if I'm not sure what the drill is, I'll ask the coaches, what is the goal, so that I can kind of adapt what I would like to see biomechanically from the athlete to make sure that it's still meeting the objective of what they need to be doing. And then finally, is we created an injury report this year, so to kind of help bridge that communication with the coaching staff. That way he knows when I take a girl out, and then the difference between a girl taking herself out. And with that, then he can kind of circle around with the athlete to make sure they're not stepping out when they should be stepping in, as well as then he's not getting after the girls that I've taken out of the game or limited from the practice. And then just to kind of give you a little bit of a timeline of our work with the Vixen, as you can see, it's not a super long time that we've been working with them. In June 2013, that's when the first conversations began with the owners. January 2014, they started practicing on our campus, and then if they were injured, they were being seen in our Bloomington clinic. In that fall, so after their 2014 season, they started the strength and conditioning camps, which was run by Dr. Stark, and then also some of our students that had gone on and done their CSCS, which is Certified Strength and Conditioning Specialist. In January 2015, this is when I got to join the team, they started practicing on campus. We started being there for practices, so we would triage on the sidelines if they needed something, as well as that's when we started incorporating that last 30 minutes of conditioning, core, and mobility training. In April of 2015, we opened up the clinic. At that time, it was myself and a couple of Rockstar interns, so they were only receiving chiropractic care. And it was slow. We probably had like 4 people that used it pretty consistently, but I was happy. At least we had somebody using the care. And then again, if it was an injury, they were referred upstairs, up to the Bloomington clinic. In June, after their season, we added the TCM practitioner, so Kate and an intern, and then she later got a second intern. And so that's when we really started focusing on the integrated care, because we wanted to promote the athletes coming in, and we had the time in the schedule, so it would be, they would come in usually to see me first, just because I had that relationship with them already, and it was, this has been kind of something we've been dealing with all season, let's see what acupuncture and Chinese medicine can do for you. And that started really building up the schedule. In October, we added massage. We had Mary Smith, as I mentioned. She graduated from our massage therapy program here. She had worked with us when we were working with the Swarm, and was really looking for a way to kind of stay involved in the Human Performance Center. And then she's also still a student here at Northwestern, so that made it okay. And then this fall, they also did the strength and conditioning camps again, and we're here today. So they have sorry about that. So now we're on their sidelines. We have, they can come in for the clinic. They're doing their strength and conditioning. And I think I have, where are we going next? Yes. Okay, so what's next? We've added the Minnesota Freeze. They have yet to sign up, but they have this password and the website. So we're excited. It's an Aussie Rules football team. So we're expanding our clinic. And then Kate and I have kind of talked about, what would be the next step. And we've kind of talked about having a lead practitioner. In, those high-level sports medicine, it's usually like a head athletic trainer, someone just kind of overseeing everything. And so that's something we've toyed around. We're not quite there yet, but maybe somewhere to go in the future. Just someone to kind of, they're not going to dictate what we do and how we collaborate or integrate right now, but just, a watchful set of eyes to make sure everything is happening as it should.
And I think part of that too is as we grow, so like Dr. Moose was talking about when chiropractic started, there was about 4 people that would come in a night, and now we're seeing, I don't know, yeah, 15 to 20 to 25 women in an evening. So we are moving and grooving, and the interns are getting a great experience. I have 3 interns, and chiropractic has 2 interns. And so we have so many people coming in, and as we were talking about, there's always limitations within a clinic, right? So we've talked today about all these wonderful things that we're doing in the Human Performance Center and how you can integrate care. There's also limitations in what we have going on, and part of what we would like to see moving forward, possibly having a lead practitioner, that in a lot of cases in integrative care with sports medicine will be an athletic trainer. So something we've toyed around with, especially when we're building our numbers, that there's somebody actually doing that coordination of care. And then as we're on the ground level, making sure that the care for that specific athlete, the cases are being discussed, and they're getting the best possible care. We've also talked a lot about integration on the sidelines. So this is an area that I see a huge opportunity. I'm surprised that there aren't more professional teams that have grabbed onto this approach, because there's so many things that can happen on the sidelines. You can do evaluations, you can possibly do adjustments. I mean, acupuncture in general is great for very close to after trauma care. So there's actually a lot of research that's been done over the last like 3 or 4 years, so there's lots of work that we can do on this, but how quickly the athletes are able to get back onto the field when they get that integrated care on the sidelines. And I'm not talking full treatments and treatment tables and all of that, but what type of things can we do on the sideline? How can we get the blood flow moving for this patient because their knee just got injured? The chiropractors or whoever's on the sideline is doing an evaluation. This is the injury that's happened. You put a couple of needles in, there's a little bit of soft tissue work. All right, they're sitting, they're icing, or they're heating, or whatever needs to happen. All of that can happen on the sidelines and actually get those athletes back on the field, because that's where they want to be. I worked with some Nike athletes out in Portland, Oregon. I didn't mention this earlier. And I had this one guy who was really having trouble running, working with his knee. Came in and he said, you know, I just hurt it. I just need to get back. I need to get back on the track, no matter what. Like, you know, for me, I was like, well, we need to rest, and that wasn't going to happen. I could see that. But I said, you know, we're going to give you a treatment today, and tomorrow, just take it easy. You know, maybe the next day after that, and then just kind of do some light jogging, whatever. Came back the next week. Oh, my knee's terrible. I said, well, what happened? You were feeling great when you left here. I went out and I could run like 7 miles, like literally left and went in running again. So athletes want to get back on the field. So how can we take this model, possibly integrate it onto the sidelines, give the athletes the best care that they can do, so that they're doing what they want to do, which is be on the field or be on the court or be on the ice or whatever other sport the person might be playing. Other opportunities that we have out there. So similar care throughout the university. Again, we talked a little bit about integration and what that means. You know, where do you see integration in the integrated clinics that you see around Minneapolis? What does that look like? Is it just a bunch of different practitioners in a hallway? That's okay. Are they talking to each other? And how can we use that word integration to the best practice for the patient, right? How do we use this patient-centered care to be giving the patients the best thing that we can? So, you know, using the model that we use in the Human Performance Center in the Bloomington Clinic, in DeRusha, in private practice. Again, I'm not going to go down this rabbit hole, but it is important to talk about limitations, right? So we've had a lot of great discussions about what would this look like in a private practice setting. Well, it's interesting when you get payment involved in how that works. So you're going to do grass today. Well, but what if I was going to do gua sha and bill for that? Or what would, you know, so that is something that I would be really happy, because we've had a lot of discussions about this and how that model can go out into the public arena. But if you have any questions about that, we can talk about it afterwards, because it is a little bit of a rabbit hole, but it is something to think about. How would you do absolutely integrated care, like we're talking about in the Human Performance Center, out in a insurance-filled world? So, all right. Any last?
And then we mentioned that there's similar care happening like this throughout the university. We had a couple of Olympic athletes that came up, and so not in addition to traditional Chinese medicine, massage, and chiropractic, we also took advantage of the Sweary Center and their biomechanics lab. And so that's one example, and then it's slowly starting to happen up in the Bloomington Clinic as well. We were approached by a patient, and so there is one patient that's happening up in Bloomington where they're being treated by all three disciplines, and they have requested that all three disciplines, get together and work together. So it's slowly starting to happen, and we're excited to kind of be on the forefront, because it was very nerve-wracking for the Bloomington folks to kind of take this on. And I just kind of paused and said, don't worry, it's already happening down in the Human Performance Center. It works really great. Want to hear what we learned? And so it's been exciting to kind of have them lean on us about what's worked and what hasn't. Any questions?
Yeah, I was like, somebody has.
Because we have mostly chiros here, if a chiro wanted to add a TCM provider into their practice and move towards further integration, what one or two suggestions might you have?
To find a traditional
To
Chinese.
find a TCM provider and integrate them.
And integrate them. So one thing that we've found over the time working together, I'll speak to kind of once the person was in the clinic, we learn a lot from each other. Because when you're working side by side with somebody, I need to know a little bit more about chiropractic and how your distance is working, or how the adjuster is working, because that was called adjuster, yes. Or what is activator? There we go.
There you go.
So and in the same aspect, it's really that communication between practitioners is huge. And so I think that if a chiropractor wanted to find a traditional Chinese medicine practitioner to be part of their clinic, there are a couple questions. How many hours of training did you get? What specialties have you worked with? How long have you been in practice? Do you work with herbs? I think that's an important one. At the school I went to, it was required that you did that, and there's a lot more diagnostically that's involved in that. So that would be another question. So you understand what level of training somebody's had before they come into your clinic. Are they gonna wanna bring in herbs or topical things, and how does that complement or not the practice you have set up? Or maybe you actually go in together and start one at the same time. Did that kind of answer your question? I think communication is key, and I think there's a huge learning opportunity also for the practitioners to learn about how their medicine works and respect everybody's medicine. I mean, we have great conversations all the time about our limitations of our medicine and how the other person can complement complement that. So, and I got a couple of you laughing out there. It's still awake. Okay, yeah.
And I think the other big part of that is making sure your egos are set aside and that it's about the patient. It's very easy to kind of get in there and be like, well, I do this and I want to do that, and I'm really good at this. And you kind of have to scale back and be like, well, what's best for the patient? So, it's great.
I know you have 4 minutes, but pre-performance screening is a huge thing. Are you guys, and I just didn't see it talked about, do you do that?
We do that. So that we will be running our third pre-sport physical for the Vixen this February. And so we've done it the previous 2 years.
What does that consist of?
Oh, the gamut. So we have an EENT station, we have a vital station, we have a history station, we do heart and lung sounds as well as an ECG. We at first started, we're doing the FMS screening and kind of moved away from that. We use components of the FMS screen, but we've kind of created our own functional exam, evidence-informed functional exam, a little bit more sport-specific and female-specific for the Vixen. Concussion testing, or baseline testing. Am I missing? Those of you that volunteer all the time, am I missing anything? MSRs, like an orthopedic exam. It's pretty,
And it's
yes.
mandatory for everyone to go through that?
So it is not mandatory, but highly encouraged, and if the players do not go to ours. They are required to bring paperwork to the owners saying that they were cleared medically. We haven't, nothing super serious has come up in my experience yet, but we have had to refer out for some abnormal ECG reads, just to get a second pair of eyes on things. And so, good question.
And the last, does that help when someone does get injured? Have you, so that Achilles ruptured or anything, that low back, yeah, there was a keg incident, I've been there, we've all had those. But was there something that, oh, hey, this person might be predisposed?
We did notice, I mean, don't have anything documented, but some of those we did notice, you know, maybe they weren't moving the best, or we had, you know, encouraged them to take advantage of, you know, the injury prevention clinic, or doing simple things like foam rolling and making sure you stretch afterwards. So nothing that we were like, this is for sure gonna lead to an injury.
Yeah.
But it's definitely something we've been talking about now, being a year into this like full on integration with the team, looking at, can we go back and see if there were predictors that we missed?
Yeah.
And
I'd
because
like to hear about that later.
future research study, I guess.
Huh.
And
Any final questions?
Thank you, Katie and Dr. Moose. Thanks, James, and in respect for the next class that needs to get in here in about 2 minutes, tidy up a little bit. Surveys in the back, please. If you haven't signed in, please sign in so I can have an accurate list of names that showed up. What's that? And hope to see you in February.